Mr. President, I enjoyed listening to our friend, the Senator from Minnesota's comments, and I would just say a couple of things. One is if 10 or so Democrats would have the courage to work with us, we could pass a true bipartisan health care bill. But the message we've received from the Democratic leaders, Senator Schumer and others, is that they don't want to get involved in the process. So it's a little hard to take seriously the statement that if we would just be willing to work with them, we could get this done because we've asked and they have refused. But it's not too late. If we could get a bipartisan group of senators to actually improve the status quo, which is a disaster under Obamacare, then I think we could make progress. But that's not what I hear. And I hear senators criticizing the House bill. I guess that's because they haven't read the Senate bill. And we've said all along we want to improve on what the House did. And I think the draft bill, which is just that, it is a draft, it's a work in progress, does represent in many instances an improvement over the House bill. So I look forward to working with a coalition of the willing, whoever that might be. I hear some happy talk, but I don't see many people willing to cross over and actually work with us, roll up their sleeves and do the hard work to actually pass a bipartisan bill. And I just have to say, I hear the criticism about cutting Medicaid. Well, the fact of the matter is, under the draft bill that was filed today, the essential safety net for low-income Americans is preserved. It will end up spending more money next year than this year, more money the following year, because what we do is we add a consumer price index increase. Now there are, as the presiding officer knows, being a practicing physician, this is a complex issue. But the fact of the matter is, it's absolutely critical to reforming Medicaid and making it work better. We also, in addition to spending more money each year, which is not a cut in most of America, maybe it is in Washington, D.C., as we all know, Medicaid is an open-ended entitlement. So if you qualify based on your income, then you get access to Medicaid. But Medicaid continues to drive the budgets, not only the federal government, but also the state government, and crowd out other priorities, which are also important, things like law enforcement, education. And what we've decided we must do is to put Medicaid on a sustainable path by spending more money each year on low-income Americans. Now, we still have some more work to do, but the idea that just because compared to an uncapped entitlement with no limits on spending, we end up spending a set amount like we spent this year or next year and add more each year based on a cost of living index, that somehow is a cut, is just ludicrous. That's not certainly my understanding of what a cut is. It's a reduction in the rate of growth. So if you call that a cut, well, that assumes that we are going to spend all of that uncapped amount of money, and we can't sustain the program if we do that. This is one of the three major entitlement programs: Medicaid, Medicare, and Social Security. And I think it's our obligation, our duty, as we are saving the millions of people who are being hurt by the status quo in Obamacare, to act responsibly to make sure that this safety net program is available for low-income people going forward. We all should agree on that it's important, and that we ought to put it on a sustainable, responsible fiscal path. So this was kind of an interesting experience here this morning. We roll out the discussion draft of the Obamacare repeal and replace bill. We put it on the internet, we make sure everybody has access to it, and we ask for their input, their advice, and their suggestions. And we're starting to get it. We welcome suggestions that people have to this initial discussion draft, but you have to start somewhere, and this is where we're going to start. And then we'll have a process next week whereby any senator who has an amendment to the bill has an absolute right to file that amendment and get a vote on it. I can't imagine a more transparent and open process than put it on the internet, invite people's comments and discussion, and then have an open amendment process following debate, and then vote. That's what we're supposed to do. Vote. So I think today represents a big step forward in saving those Americans who are being punished by health insurance choices that limits their right to choose a product at a price they can afford that suits their family's needs. We know what the promises were, and I guess I just have to repeat them again. President Obama said, if you like your policy, you can keep your policy. If you like your doctor, you can keep your doctor. If average family of four will see a $2,500 decrease in their insurance premiums. What we've seen is a $3,000 increase in insurance premiums for the average family of four. Not a decrease of $2,500, an increase of $3,000. And people who buy their insurance, buy their health coverage on the insurance exchanges in the individual market have experienced a 105% increase in their premiums. Now, I don't know about you, but there are not many things that come out of my paycheck where I can sustain over a period of just a few years an increase like that, 105%. Imagine if you had a 105% increase in your rent payments for your apartment, or your mortgage payments for your house, or your car payments, or anything else. That is harmful and damaging to hardworking Americans, and it really is a breach of faith with them when they were told, when Obamacare passed, that they would actually save $2,500. But this discussion draft that was released today and put on the internet is available to anybody who wants access to it, is a product of years of debate on this floor and discussions among not just Republicans, but the entire Senate and our constituents too. We made our ideas public and we sought feedback. The Senate Finance Committee alone, which the distinguished presiding officer and I serve on, has had no less than 36 hearings on Obamacare since 2011. Ranging from the high cost of Obamacare to transparency in the Medicaid system. And just this year, there have been dozens of meetings throughout our conference. We'd love to include Democrats, but they've chosen not to participate. Since May the 4th alone, 18 of our conference lunches have been entirely dedicated to health care. I mean, there's a practical reason for that, too, because without Democrats participating in the process, we have 52 Republicans in order to get 51 votes to pass a bill. That means everybody is essential to a successful outcome in repealing and replacing Obamacare. So no one's been excluded. Everybody's ideas have been solicited. So that doesn't even count individual meetings we've had with senators and constituents. Even after receiving this discussion draft, some of my colleagues across the aisle continue to refuse to enter into debate because they say it's not a final bill. Well, that's the point. We didn't present this as a fait accompli. We presented this as a place to start. And they don't even want to start. All they want to do is criticize, but they don't want to criticize an actual bill. They want to criticize the House bill because they haven't even read the 142-page Senate bill. This is called a discussion draft for a reason. We're opening up a conversation and a discussion with the American people. But we know Senate Democrats have chosen not to help to clean up the mess left by Obamacare. I don't really understand how they can turn a blind eye or a deaf ear to their constituents. I'm confident for all of the people who are writing and calling me in Texas that they have to have people in their states that are calling them saying, my premiums are skyrocketing. My deductible is so high that I effectively don't have access to insurance. And oh, by the way, the insurance companies are pulling out of my state as fast as they can because they're hemorrhaging money. I don't know why they are not motivated to work with us, but apparently that's the decision that they've made. But unfortunately, I think it goes back to this. When President Obama visited Capitol Hill the last time, in January 2017, he had one message to Senate Democrats, and that was, don't work with Republicans on health care. The President of the United States said, don't work with Republicans on health care. Now, this flew in the face of 3 consecutive elections since Obamacare had passed, where the voters clearly had demonstrated their dissatisfaction with how Obamacare actually worked. That shouldn't have been a surprise to anybody. I remember being here on Christmas Eve, 2009, maybe it was 2010, when Democrats passed Obamacare with only Democrat votes. I stand corrected, it's 2009. 7:30 in the morning, no Republicans voted for the bill, only Democrats voted for the bill. Since that time, they've gone from 60 Democratic senators down to 48. They went from the majority in the House to the minority in the House. They went from holding the White House to Republicans now holding the White House. To me, the message isn't all that confusing, nor is it subtle. It's clear to me that the American people have rejected the promises, the failed promises of Obamacare, and have frankly punished our Democratic colleagues for passing it in the way they did, and as a result of the failure to keep the promises that were made when it was sold. Well, I've heard these concerns from my constituents in Texas for the last 7 years. I've read their letters and their emails sharing some of their stories here on the Senate floor. This law has been expensive, about $1 trillion in new taxes. People wonder, well, why hasn't the economy grown during the Obama administration since the Great Recession of 2008? Well, one reason is because of the huge tax burden and because of the regulatory burden imposed on small businesses, which are the primary engine of job growth in the country. And Obamacare has been part of the reason for that. Well, this discussion draft does, to my mind, 5 things. First, our legislation zeroes in on the unstable individual market. Under Obamacare, insurance markets across the country have languished under high costs and taxes. And the result has been that 70% of counties nationwide have less than 2 insurers to choose from. Less competition means higher prices because companies don't have to compete for the sale of a policy. And in my state, 1/3 of Texas counties have only one insurance option. That's not exactly a choice. That's a monopoly. Our legislation will help the collapsing insurance markets that have left millions of people with no options by creating a stabilization fund that will balance premium costs and address the lack of coverage that so many across the country have been experiencing. And I don't care what our critics say, we're not pulling the plug or the rug out from anyone. We will continue federal assistance for health care markets through 2021 to make the transition smooth, much unlike our experience with Obamacare. Ultimately, if we want to encourage a market to lower costs while providing better quality care, we have to get the government out of the way. You know, that's the only thing I hear from our Senate Democrats. They want more government involvement in your health care. That seems to be their default position. Well, we know from the failed experiment of Obamacare that it doesn't work, at least insofar as the promises were made when it was sold. So why would they default to a position of more government as opposed to more freedom? To let people choose, not government choose for you, and to punish you with a penalty if you don't buy the product that government orders you to buy. Well, our second goal is making health care coverage more affordable. Under Obamacare, taxes and mandates cost the American economy $1 trillion. I mentioned that a moment ago, which, as our constituents felt firsthand, was ultimately paid by patients through higher health care costs. Our friends across the aisle think you can raise taxes by $1 trillion and it won't have any impact on the consumer. Well, that's just ridiculous. We all know that those expenses get passed on to the consumer, and they get passed on in the form of higher health care costs. So when you tax prescriptions, for example, well, it's going to cost more. When you tax health insurance plans, which Obamacare did, premiums are going to go up. And guess what? Taxing medical devices increases the cost of those devices and leads to job losses because they leave the United States and they make those medical products, those life-saving medical products, offshore in order to avoid the medical device taxes. These taxes and mandates have crippled our economy. And my colleagues on the other side of the aisle recognize that as well. That's why our health care plan will improve affordability by addressing Obamacare's taxes, which have hurt American families directly, by making their health care less affordable. This framework provides a long-term state innovation fund that encourages states to assist high-cost and low-income individuals, making health care more affordable. So we're also encouraging tax credits to help defray the cost of purchasing insurance adjusted for age, geographical location, and income, so that those who need financial assistance get the help they need. Health savings accounts will also be expanded under our draft, giving Americans the choice of buying a hospitalization plan, which covers major medical costs, but not, if they choose not to buy a comprehensive health insurance policy, but rather to save money in a health savings account, to use that for health care if they need it. If they don't need it, they can use it for their savings. We give them that option, which they don't currently have under Obamacare. The third principle is something our Democratic colleagues can certainly agree with us on, I assume, unless their reflexive action is to disagree with us on everything, regardless of the facts, which sometimes seems to be the case, and that is we should protect those with pre-existing conditions. No American should worry about their ability to be covered when they move from job to job. Our draft legislation also allows children to stay on their parents' policies through age 26, and there are no changes to health care for veterans, for Medicare, or changes to Social Security. Our fourth point of action is safeguarding Medicaid, which I addressed a little bit earlier, by giving most states more flexibility. As we know, Medicaid is paid for by both a state and a federal share, but the federal government sets the conditions by which that money can be spent in the states on health care as part of the low-income safety net. But bureaucrats in Washington, D.C. shouldn't decide how Medicaid is applied in Texas. I don't know what rationale exists there. Why should the federal government tell the state how to spend its own money under Medicaid? I believe that the states know how to handle this best because they are closest to the problem, and they can design health care programs that meet the needs of those states. I dare say the health care needs in Texas are much different from states like Vermont or Idaho or other states like that, smaller states certainly, more homogeneous population. We've got a very diverse state. We've got a large number of non-citizens in my state. So why not send the money to the states and let them give them the flexibility to design programs that deal with the needs of their people. That's why our draft allows states to choose between a block grant and a per capita support for their Medicaid population starting in 2020. But we've done our dead level best to make sure our draft doesn't leave anyone out, to ensure that the most vulnerable have protection, including children with medically complex disabilities. And perhaps most importantly is the fundamental goal of this legislation to free the American family from Obamacare mandates that have hit them where it hurts the most. We're giving Americans back their freedom of choice when it comes to health care, which has so long been denied them under the command and control regime of Obamacare. Our health care plan empowers families to make their own choices, and it repeals the individual mandate which punishes you if you don't buy the government-approved policy, and the employer mandate, which has resulted in people going from full-time work to part-time work because employers have sought to avoid that penalty. And finally, no longer will folks be forced to buy plans they don't need at a price they can't afford. This, I believe, is a framework for better care. But we're going to continue to discuss this plan and talk to anybody who's willing to talk to us and work with us. If there's a way the bill can be strengthened, I am open to it. But the status quo isn't working, and our Democratic colleagues know it. I likened this morning to happening upon a terrible accident on the highway. You know, people have been injured, but we have two choices. We can either stop and render aid, which is what we're trying to do to people hurt by the failures of Obamacare, or you can drive right on by. Unfortunately, our Democratic colleagues have simply chosen to look the other way and drive on by. But before them is a real solution, one that has a chance to change the lives of millions of Americans for the better. So we hope they would reconsider and join us.